You're live.
Great, thank you. All right, so good morning, everybody. This is the Subcommittee on Public Health for the Cannabis Advisory Commission for the state of Nevada. Could everyone mute their themselves for the second? I think there's just a bunch of background noise. Thank you so much. So we have a full agenda for the next hour, so I'm going to get moving. The first thing is roll call. So I'm just going to go through here. So we have Jennifer Pearson, me, I am here, I'm the chair. Benjamin Chu.
Here.
Lauren DePreet.
I'm here.
Teresa Hayes. Not here. And Jillian Nelson.
I'm here.
Great, thank you. The next thing on our agenda is public comment. If anyone has public comment, if you would raise your hand, I believe is what you can do. I see we do have some people attending the Zoom. Any public comment at this point? Okay, seeing none, I'm gonna move on. We also have 4 sets of meeting minutes to approve from last year. I'm hoping everyone's had a chance to review them. They are transcribed using AI software, so they are pretty much verbatim, with a few little, AI related issues here and there. But in my review, there was nothing in there that really warranted serious concern. So let's just go with the first set of meeting minutes for August 25th, 2021. Do I have a motion to approve them?
I move to approve. This is Ben Chu for the record.
Do we have a second?
I'll second.
Thank you. All those in favor say aye. Aye.
Aye.
Aye.
I can't tell if Jillian said aye or all those against say nay.
Aye.
Okay, thank you. All right, so those have been approved. Do we have to do these all separately, or can we just consider them all at once?
Rosalie Bordelove for the record, I'm here as your counsel, so I'll help you.
Thank you.
Yeah, you can combine any items at any point if you want. Just all I ask is that it's clear for the record what you're combining
Okay.
and what's being moved.
Very good. So do I need to put combining up for a vote? No?
You don't. Anyone could just make a motion to approve multiple items at the same time.
Okay. Well, I would like to propose that we do that just so that we don't have to go through this process 3 more times. I see some nodding. Would anyone move to consider agenda items 2, B, C, and D, which are the minutes for September 20th, 29th, and October 19th, all in 2021? Would anyone like to move to combine those and approve them?
I do.
So
I'll move to approve what you just
Okay.
said.
so Commissioner Chu moves to approve them all at once. Do we have a second?
I will second that, Lauren DePreet.
Thank you, Lauren. All those in favor, please say aye. Aye.
Aye.
Aye.
Aye.
Aye.
Thank you. All those opposed? Nay. No nays. Great. So we've approved all of the meeting minutes efficiently. All right. The next thing on our list to do is to review the petition filed pursuant to NRS 6878A 461D. Sala Consulting on behalf of RNBW petition to amend NCCRS 1456911 13 and 16 as requested by the Cannabis Advisory Commission. I believe that all of us have had a chance to review that. I'm looking at the attendees on Zoom and none of those names are familiar to me. I am wondering if there's anyone from Sala Consulting on the Zoom, just for my own information. perhaps if you're from Sala Consulting, if you could raise your hand. Okay, I don't see anything. Okay, so that's fine. So I think before we get into discussion of recommendations, I'd like to give the commissioners an opportunity to bring up any questions you have specifically concerning public health for the petition. Yep, Commissioner Chu.
Hi, Ben Chu for the record. I did have a few comments on this, and I raised some of these at the CCB meeting when the Sala consultant presented this, but it looks like the intent was to allow consumption at a public event and not to have a pop-up dispensary. And the way he said that when they wrote this was before the consumption lounges were approved, and so they wanted to submit this using the dispensaries and to move this forward. But he took the language of the consumption lounge provisions as the requirements for this, and my concern about this right now is that if you have dispensary employees trained as dispensary workers, and perhaps once a year they're going to go out and provide the service, I think it'll be challenging to expect them to truly grasp the differences between a dispensary and a consumption lounge, and that could lead to some significant mistakes on their part, unintentional. I mean, it's going to be something. Oh, you know, I was always able to sell, 4 candy bars to whatever. To here, they might do that. They don't have training on overindulging materials, things like that, and everything that we discussed before. And so I think to throw an employee into that situation could have significant consequences for the customer, for the consumer, getting more than they should be. And then this would result in fines for the dispensary because they allowed something like that to happen. And so I was thinking it made more sense now to tie this to a consumption lounge license, where you have employees who have been properly trained and do this every day, and so they know what to deal with and how to work out these things there. Because then it's really not any different from if a restaurant were to open up a stall at a festival. Then it's just the change in venue is the only thing that they have to worry about. Then those logistics don't, but they already know their job ahead of time.
Yeah, that's a great point. So it's kind of similar to, would you expect a liquor store employee to turn into a bartender for one event and then go back to being a liquor store employee? They are different.
Yeah, I don't think it's fair to the employee, and I think it could cause some big problems. I also think, I don't remember if we have provisions that you're not allowed to remove leftovers from a consumption lounge.
Yes. So in the petition, as I understand it, people will not be purchasing single-use products, and they will be destroyed upon leaving the consumption area. So you can take them out. Yeah.
So there's just something to think about there, especially like vape pens and control of that. How you're going to, deal with that one. The other thing I had was, the point of sale, it must have access to the internet to deal with metric, to deal with checking IDs, things like that. And at these large festivals where you have potentially so many cell phones in the area overloading the cellular network, the venue needs to provide a reliable Wi-Fi connection that they can use. And if it goes down and drops for any reason, then you have to halt sales at that point. The other thing I saw in here, and it's not necessarily public health, was the provision in there from distance from schools, which is 1,000 feet, or a community facility, which is 300 feet. Do parks count as a community facility?
They do. I believe they do. Yes.
So this would automatically exclude events held at a park. All these places. There are a lot of things. I know we're talking about, Life is Beautiful, the really big ones, but moving forward, I thought this was sort of a pilot, and then they'll start moving this down to smaller venues. Well, a lot of smaller venues do take place at parks. Parks are very close to schools. So
Yeah.
first of all, is the park itself, the community facility. If you're in a community facility, then it automatically excludes you. But if you write an exclusion for this, then you have to worry about where the park is in relationship to the schools. A lot of them are very, very close. For instance, up where I live, Floydland Park is less than 500 feet from an elementary school. There's also, I kind of looked up Life is Beautiful, which is the point of this whole thing that they're trying to go to. From the website, it says it encompasses 18 city blocks from the heart of the city, extending from 7th to 11th Street and from Mesquite to Carson Avenue. Well, the corner of Carson and 11th is 650 feet from a private school. So the way they wrote this, it was the edge of the event, not from the edge of where the tent or wherever this thing is supposed to be, had to meet these regulations. So automatically, Life is Beautiful would be kicked out of this, which is the point of what they wanted to do.
Sure.
So this isn't really a public health issue, but it's more logistics of how they wrote this, because we did bring up in there that, perhaps you want to make it measured from where the lounge
Where the
is
consumption areas are,
versus anything else that might make you a little easier to fit into where you want to go.
I think that's absolutely a public health issue, because the location restrictions, the whole idea behind those is that we don't want to have, places where kids go. So parks, libraries, schools located near a dispensary. That's the general idea, or a consumption lounge. Now, I think that concern, if it's a one-time event, that concern is not the same, But at the same time, we might have neighborhoods that are not excited about having a big festival where people are consuming cannabis at their park. I hear what you're saying, and I think they may have restricted themselves into a corner that doesn't make sense from a public health standpoint. On the other hand, I think we need to encourage them to think about, like, how do they, well, I guess that's just kind of permitting, right? That's not really on us. Is some parks are just not appropriate for events that allow consumption of alcohol or cannabis, so, okay. So I wrote a bunch of that stuff down. I see Jillian has her hand up. I'm sorry, Commissioner Nelson, what would you like to bring up?
So first, I agree with everything Ben is saying. I do have a couple other additional points, though. Firstly, this petition, it limits only events that are over 25,000 people. And I do see some issues with that, because there will only be a handful of events within the state that could accommodate it. And to Ben's point, Life is Beautiful was talked about a lot in the introductory meeting about temporary cannabis events, but it doesn't seem like that event in particular could actually host a temporary cannabis event due to its proximity to schools, but also casinos. I believe that casinos are a limitation to this as well. And Life is Beautiful literally has the El Cortez as part of its footprint. So yeah, that event wouldn't qualify at all. Furthermore, Life is Beautiful in particular is an all ages festival. And this petition says that these events can only be 18 plus. So in essence, I think that the only thing that could apply to this would be EDC. We talked about Burning Man in the previous meeting, and since Burning Man is on federal lands, they would be excluded from these events being able to be licensed because they can't have it on federal land. So I do see a lot of restrictions with how these regulations are being proposed. And it's very isolating to where we're creating all of this regulation and all of this permitting that would only benefit one annual event for our whole state from how it's currently being executed.
Yeah. I think one thing I just want to put out there about Burning Man is they are explicitly anti-corporate, anti-sales. I don't see them ever allowing anything like that. Even if it were federally legal, I don't see them ever doing that. Like the only thing they sell there is ice and coffee, and that's Burning Man sells it. And I believe they've stopped doing coffee because of concerns about waste. So, you know, I think let's not worry about Burning Man for multiple reasons. But I think the idea that personally, I'm a little confused about how to think about this because it's framed as a pilot. So, you know, it's difficult for me to think about how this would go for one or two events versus statewide. And I forget who brought this up. I think at the CCB meeting about this, but someone said, you know, why are we doing this? Didn't the legislature say they didn't want to do this last time around? And the response was correct. And so what we're proposing here is a trial to see how it goes. And so it's still difficult for me recognizing that like pilots often turn into, well, that works, so let's just do that. I understand people's concerns about not wanting to like privilege just a couple of events and shut out other potential participants. That being said, I feel like it's like that's more of a CCB or like market stability concern and not so much of a public health concern. Member Dupree, what do you have to say there?
Yeah, so I have a couple thoughts. One, and I agree with a lot of what's been said already. I'm a little confused why the requirement for it to be such a big event, because I can kind of echoing what's been said. I don't know how many big events will be able to have the capacity to host that many people and stay away from a casino or a park. I mean, just the footprint that you need to have that many people. So that was a little confusing to me. Also, I think, as can be expected, I have a couple of concerns about the lack of discussion about preventing contamination at these events. I mean, these are things that will be going into people's mouths, similar to food. So I see a lot of, similarities with some of the things that we do. I think kind of building off of what Commissioner Chu said in terms of it might make sense for this to be tied to a consumption permit rather than a dispensary permit for a lot of those reasons. Are we envisioning just pre-rolls, edibles, just pre-packaged, or is it going to be infused meals? I don't know if there's any requirements here that are saying it has to be one or the other. Either way, I have concerns about protecting that from contamination, which means, maybe requiring it all to be prepackaged at the facility where you have your resources for cleanliness, and then only selling prepackaged items at the event, requiring a hand sink for staff to wash their hands after they sneeze or something like that, handle the money, things like that. So I would like to see this beefed up in that regard, whether it's echoing, I don't know if it makes sense for it to be put into this document or, have like a temporary event guidelines, a separate document that you reference. But I think that we need to provide more guidelines for preventing contamination and potential outbreaks at a temporary event. Also, I see here that the inspection may just be a review of operational plans. And that worries me a little bit because at a lot of temporary events and special events, we've seen operational plans that look one way, and then we see the actual operations looking very differently on site. So for temporary food establishments, we always require an on-site inspection. I would recommend that there would also be an on-site inspection for any kind of cannabis temporary event.
Thank you. And perhaps Ms. Bordalov could clarify for me, but because this is a petition, my impression is that coming up with all of the details here is not on us. It's on the petitioner. So if we say your petition does not adequately address these issues, you need to, like, we as the advisory commission subcommittee believe you need to address these following things so that you achieve these goals. Come back to us with ideas that is appropriate. Like, we don't have to rewrite their petition for them. Is that correct?
Correct. There's a few different, and Rosalie Bordalov for the record, you're tasked with providing recommendations to the larger Cannabis Advisory Commission, who's then going to come and probably put together a more complete set of recommendations that they give to the CCB, and CCB is going to decide on this petition.
Yeah.
So you could make a recommendation generally that from a public health perspective, this petition be granted or denied. Obviously, what's probably the most helpful for the Cannabis Advisory Commission is a list of ways that you kind of say you could have a for or against recommendation that you make one way or the other. Not every subcommittee has been doing that because there's just a lot of issues they're raising. You could also simply say, if you choose to approve this, here's concerns we have, here's some recommendations. If you can come up with recommendations to how to fix them, sure, that's great. You could also say, here's concerns we have and we can't figure out a way to address them. And kind of those are issues. And it's really kind of up to you guys from the public health vein to really, your job is to really identify these issues. And if you have great recommendations on ways to address the issues or ways it could be changed, that's great. But if you don't, that's something that could be put on the petitioner to say, we don't have a way to address this issue. And part of your job is simply also flagging those issues.
Right. Okay. Thank you. That's helpful. So as we're talking, we're going to talk about what our next steps are. And I just want to keep that in everyone's mind. I think our first thing is, our goal is, recommend yes or no. Our second goal is, what are the potential deficiencies? And then our third goal is, given those potential deficiencies, what do we recommend? Okay. So Commissioner Nelson, what do you have to add there?
I just wanted to express my support of everything that Commissioner DePreet was saying, especially highlighting her comments on the idea of only serving prepackaged edibles or prepackaged cannabis products. I think that's a really good idea and would help simplify a lot of the execution and food safety aspects of these pop-up events. Also too, I definitely heard what you were saying about Burning Man, and I agree, like, it makes sense just to kind of like, all right, yeah, that's not a concern either. But back to the comment about the 25,000 person limit, again, I think that is starting a little bit too strong, and there's many other events that could be at a much lesser scale that this would be easier to introduce into the market and test out.
Right.
And with the idea of it being a pilot program, I do understand that we kind of need to run with the training wheels on for a little bit before we get going all the way. But there are events like Reggae in the Desert, for instance, that would be very good, and but still not reaching that 25,000 person limit. And I think from not only a compliance standpoint, but a public health standpoint, it is easier to monitor and regulate smaller events and then build up to larger scale productions as the ball gets rolling.
Yeah, so I agree with you. So my number one concern when I read this petition and when I saw the CCB meeting, and I wasn't able to attend the advisory commission meeting because I was teaching that day, and I was like just once a week class, so I can't dip out of those. But my number one concern is overconsumption of alcohol. Now, overconsumption of cannabis, it sucks, but you're not going to die. But overconsumption of alcohol will absolutely kill you. So when we're thinking about an outdoor event, perhaps in the summer, perhaps in Vegas, and then we have people who are perhaps their inhibitions are reduced because they've smoked a joint, and then they go drink a bunch of alcohol, they're not in a good place to self-regulate, and we could see incredible amounts of people going to the ER, for example. So quite a lot of like burdening of local hospitals. So when we think about the size of the event, 25,000 people, where this is the first time they've ever been able to, purchase and consume cannabis and purchase and consume alcohol on site, I just see a lot of people going, wahoo, and going for it. And there's, in the petition, they talk about having cannabis consumption areas where people are not allowed to consume alcohol in those areas. However, once they leave the area, they talk, there was like a brief mention of like wristbands, but and then they were like, yeah, but wristbands can be taken off. And to me, they did not do an adequate job planning for, or how do we say this? They need to set up a regulatory infrastructure so that they are not encouraging overconsumption. Recognizing that, okay, yes, people do this already. They bring in products, they use them surreptitiously, and then they consume alcohol in whatever order. Absolutely, that happens, but we should not be setting up an infrastructure that facilitates that, right? And it also has like liability issues for the event promoter, 100%. If you're not doing your due diligence, keeping people who are inebriated from becoming more inebriated, like I can totally see that being a liability issue. So I would like to see the petitioner come up with some creative solutions to that. It doesn't necessarily mean, I think, if you consume cannabis that day, you can't consume alcohol that day, or vice versa. But I'm sure they can come up with a way to perhaps space things out. People could have an app where they scan it and it's like, okay, you bought a joint at 1 p.m. Well, the counter has started and you can buy your first alcoholic drink at 5. That we have pocket computers now. These things are possible. So I would like to see that. And I would also like to see requiring the event promoter, though I'm actually not clear on whether or not CCB can regulate the event promoter, but I'd like to see reporting on things like how many people were picked up in an ambulance and taken to the ER, and for what reasons. I'd like to see reports of encounters with the police, or like number of people of people caught with illicit products, because the idea here is that we certainly don't want to see a spike in people going to the ER, and we also, if we're doing things correctly, we should minimize the number of people who are bringing in products that are not purchased on site. And like ideally, no one's going to the ER and everyone's purchasing their products on site, right? Like that's what we're trying to get to. And also I have a concern about this 18 and over. Why is it 18 and over when like our cannabis consumption and alcohol consumption rules are 21 and over? So we're gonna have 18, 20-year-olds who are doing their damnedest to get cannabis, right? They're hanging out with their buddies who are 21 and they're going to do their absolute damnedest. So I heard a little bit of conversation in the meetings that I listened to about, why are we having consumption areas? And I will tell you why we're having consumption areas is because of those 18 and 20-year-olds. to 18, 19, 20-year-olds. We need to have areas where you can consume and everyone in there is legal to consume. And then when you leave, thou shalt not consume. And if you're caught consuming, that's a problem. And that will identify people who are bringing in products that are illicit or not purchased on site. And that will identify people who are underage. If we don't do that, then law enforcement will have no idea who is consuming products that were purchased on site, who's of age and who's not of age. And it's just like, this is why we don't allow people under 21 in the bars, right? Just because you purchase it doesn't mean you consume it. All right, so Member Dupree.
So I agree with a lot of what you said, and I wanted to jump off of the point in terms of being able to regulate the event coordinator or the event promoter. So just to show you our structure so that maybe some of it can be reflected. As far as food goes, which of course there's food at Life is Beautiful, like we deal with EDC, all of these big events. We require that there's an event coordinator permit that's pulled, as well as each of the individual temporary food establishment permits. And the reason for that is so that we can regulate that there's going to be bathrooms, and so that if there's a broad issue with electricity or fresh clean water, I mean, that's not going to be the sole responsibility of the individual vendor. They're at the mercy of the event coordinator. So we have a separate permit for that. And then they're also required to be responsible for the food safety of the event as well. So we will give reports on the vendors. We do the inspections of the individual booths, and then we say, you know, we have a trend of this going on, or this booth is going to need follow-up, or that sort of thing. And then they're responsible for helping correct any issues that we see with the vendors or any trends that we see. So there might be room to do something similar on the cannabis side of things, just like you said, to make sure that there's Wi-Fi and connection and electricity. Like, that's not going to be the individual vendor to fix that. That's going to be at a level higher.
Right. Okay, thank you. Commissioner Nelson.
Chairperson, I thought you actually brought up a really good point with regard to the 18 plus limitations, and your whole point about, like, we don't allow people under the age of 21 to go to bars. It does kind of seem, in like looking at this in a different light, like, why are we having this limitation here? Like, either the event is going to be all 21 plus, or we need to have like dedicated 21 plus sections, but like making sure that the event is all 18 plus in general seems like a weird limitation here.
It does.
And again, I'm going to bring up EDC again, because I know that that event specifically is 18 plus, but the majority of these other events, these like outdoor festivals and whatnot that could host cannabis or temporary cannabis consumption spaces, they're not 18 plus, they're all ages. So it's like, is this like an add-on that we're doing for other places, like having a beer garden, or is this something where we're going to have like a 21 plus section of an already age gated event?
Yeah, it's to me, it is a weird requirement. I feel like sometimes I'm screaming into the void about this in Nevada, but I'm just going to continue to scream. And it's about clean air. I mean, clean indoor air, obviously, but clean air in general. I will just void screaming. Here we go. Like, you know, the standard should be clean air for both patrons and employees. And while it's great that these are all outdoor events and that will help with that, I'm also concerned that like on one hand, I could see 21 and over events don't need these age gated areas because everyone's, you know, a legal consumer. Cool, great, no problem. That doesn't address the issue of smuggling in product that's either illicit or not purchased on site. But okay, let's put that aside. However, that doesn't create a space where, let's say someone has like a pretty good case of asthma. If this is an event where people can smoke cannabis regardless of where they are in the area, then now we're excluding some people who have asthma from attending this event and being safe, right? Because they might be triggered at any moment. So they're just going to be like, it's not worth it to me to have a major asthma attack. I'll just stay home. To me, that doesn't seem fair. It seems like if you want to smoke cannabis, you need to recognize that it affects other people, and you need to be someplace where, you know, other people aren't affected. So I think regardless of the age limits, the public health priority, the like weight leans on having designated areas for consuming at least smoked cannabis, even outdoors. But like, yeah, the 18 and over doesn't solve anything, right? It doesn't. Yeah, so I don't get it. What do you think, Commissioner Nelson?
No, I agree with you. We definitely need to make sure that like there's a smoking section, of
Yeah.
course, and isolate that at like, you know, one side of the festival, maybe even more so like making sure that these smoking areas are permitted only to be on the outskirts of the festival and not centrally located to where it's not like spilling smoke into other areas. But also too, if you kind of have it in an area where it's a little bit more clandestine, I think like it doesn't show consumption to people under the age of 21.
Right.
So, but I do think that there is like a little bit of a crossover here with public health, because obviously with age, we have these limitations because while smoking is not really great for anyone, it's particularly dangerous for people underage. And so we have these limitations on age to help safeguard our youth. Yeah. And I do agree with everything you're saying. I just do think that age is related to public health and we shouldn't neglect that.
Totally. Oh yeah, absolutely. Like I could see like a 21 and over event. I could see we have less concern about, you know, discrete cannabis consumption areas, like, you know, who cares? Who cares who sees it? Obviously, we want to keep exposure to people who choose not to smoke to a minimum. And honestly, that includes the employees. I feel like it's easy to forget that, you know, employees are the ones that will actually be potentially exposed the most. So, you know, I'd like to see in this plan standards to mitigate employee exposure, which I think is not difficult to do. Like I could imagine a tent for purchasing the product, and then a tent for consuming the product, and the tent for consuming, there's fans behind it blowing smoke away, you know? And so the people who are standing there for the, you know, 12 hours a day for 5 days in a row are not, you know, essentially smoking all day. They just don't have the exposure. And the people who go into the tent and smoke and leave, like it's not a big deal, you know, that's pretty incidental exposure. So there's ways to do this. They just haven't thought about it. And there's ways to do it that aren't very expensive, you know, fans, no big deal. Like you'd probably do that anyway. It's going to be hot. So why not just position the fans in a way that, you know, reduces exposure for the employees? All right, so we have about 20 minutes left. So I just want to put that on there. I think in about 5 minutes, I'd like to talk about next steps. So I guess we're really kind of on agenda item 3, and then we kind of moved into agenda item 4 unofficially. So as far as kind of dimensions of approval, well, dimensions of concerns, I'm hearing many. What if we were to provide a recommendation to the Cannabis Advisory Commission about whether or not we feel like this petition as written can go forward? Where are you all leaning?
Ms. Commissioner DeCrete, I think as written, I would recommend no, but I'm comfortable with adding recommendations for the red flags that we see, and then, you know, presenting that as well.
Okay. What do others think?
I agree with Commissioner DePreet's position on the majority of the majority of the petition as written seems good, but there are some red flags that need to be addressed. So I think to highlight our specific points that we would like to see amendments made or changes made, or whether it be rewritten or removed, that to potentially be our process forward.
Cool.
I agree too.
Okay.
Thanks.
Yeah, I feel the same way. I think that this is, you know, it makes perfect sense to have events where cannabis is consumed. I think that's fine. It's just they haven't thought through the public health implications. I think especially polysubstance use problems. This is such a well-known effect in the literature that people who consume cannabis first will overconsume alcohol. It's like classic. So it's just like, to me, that is the number one concern, because that's one of the few things that can like legitimately cause people to die. So we don't want like a, you know, 4 people died from alcohol poisoning at the, you know, that's not good vibes, you know. And but that could totally happen. Out of 25,000 people, 100% that could happen. Commissioner DePreet.
I haven't been taking notes, but I think it might be helpful if we kind of review our big concerns. So off the top of my head, I hear the polysubstance use, whether it makes more sense to tie this to a dispensary or a consumption lounge. If it remains tied to a dispensary, we have significant concerns about training. And regardless, we have a lot of concerns about protecting the products from contamination at the event. We I think would like to see prepackaged items. I think we would like to see on-site inspections and air quality addressed and age issues addressed. Just some clarification there. And then I'm sure I missed a couple of things.
Yeah, prepackaging, air quality. And then like age restrictions.
I think the event minimum capacity as well.
Yeah. And then whether it makes sense to do an event coordinator permit for, and the Wi-Fi, right? Like there has to be a way to access all the programs.
Right. And the other one was really, how are they measuring distance to keep within the current regulations?
And I do think it, so the public health person in me is like, don't do it, but I can't really, the purpose of those distance regulations are to reduce exposure to children to seeing, like normalizing use, right? So if this is a one-time event, especially if it's happening not during school hours, I really personally.
Maybe if there's no advertisement of cannabis use
Sure.
From the out, like, you know, how, like no signs, it's
Exactly.
like cannabis garden down the street, around the corner sort of thing. Maybe that.
Right. Like from the exterior.
Yeah.
Okay, so yeah, I have several things here. So what I was thinking we could do is, like we did last time, is kind of split these up, and then at our next meeting, we can just come with a few slides with, you know, what the problem, some ideas for how to address it, and then give that back to the Cannabis Advisory Commission. And again, since this is a petition, I really do feel like it's on them to address these issues satisfactorily. We can have our ideas, but and our recommendations, and I think it might be helpful to focus on outcomes rather than processes. Like, we want to make sure that there are no foodborne illness outbreaks. That's a concern. Here are some ways that could happen, rather than saying just we want inspections. There's like a purpose to that, right? So they come up with a way to achieve, we don't want any foodborne illness outbreaks. Here's some ideas. you guys figure it out. To me, the onus is on them to satisfy us, not for us to give them the answers to their homework. So I will obviously take on polysubstance use, since that's my jam. Commissioner Chu, you brought up tying this to the consumption lounge and how that works with training. Do you want to take that on?
Yep, I can do that.
Cool. And Commissioner Dupree talked about contamination. So you want to talk about all that foodborne illness fun, so you don't have any more work to do?
Absolutely. Thanks.
Okay. Commissioner Nelson, you want to take on the age restriction question and just like what the heck is going on here?
Absolutely.
Okay. And perhaps the event minimum capacity.
Sure thing.
Cool, thanks. Yeah, I really do think, why would we want to experiment on 25,000 people when we could do it with 5?
100% agree with you.
Yeah. And then Commissioner Dupree, you mentioned the event coordination permit. Let's just say that kind of works into your stuff. And then how to measure distance. Commissioner Chu.
Yes, I can do that.
Yeah. And then Wi-Fi. You also brought it. Well, I guess it could be either one of you kind of works into either Commissioner Chu or Dupree.
Either way, I can, or.
I think it falls under both, right? Like it's a it should be a requirement that it's reliable and available, and I think it should fall under an event coordinator type. So I'll mention it in mine, and
okay.
Fine
Yeah,
if you echo it in yours.
Yeah, right. Okay. And you know what? I'll just do my mention of air quality again, continuing my screaming into the void. And great. Anything else that kind of pops out to us? Looking at my other. Oh, and you know what? I'm gonna come up with some ideas as to like data reporting. How do we know this went off well? And you know, when we talk about a pilot in like science, it is, let's just see if this works. And part of piloting is collecting feasibility data. And so, you know, how many people went to the ER? How many, like, you know, police encounters were there? You know, how many people were pulled over for intoxicated driving, et cetera. You know, I'm not exactly sure what these measures should be or how they would be collected, but they can come up with that. So, so that we can just look back and go like, did we do this well? I think there absolutely are ways to do it well. We need data in order to tell if we did it well. Yeah, Commissioner Nelson.
So in the festival Outside Lands in San Francisco, they had a pop-up consumption cannabis area called Grasslands.
Grasslands? Okay.
Yeah, it's called Grasslands, I believe. But I think I just wanted to share that with everybody because I think that could be a really good resource to see how they have executed it over there, because obviously it's been a thing for a couple of years now, and we might be able to not reinvent the wheel, but kind of take by their guidelines.
Yeah, that's a great idea. I wonder if we could get someone from them to come talk to the advisory commission.
I have a contact at Life is Beautiful, and I am trying to get some referrals for the team who set up Grasslands. I can follow up on that and see if I can try to maybe get somebody to join in on a future meeting and answer some questions for us.
That'd be great. That'd be great. Yeah. Do you know off the top of your head if they allowed alcohol consumption there too?
I don't believe so. I can't confirm that, but I'm pretty sure with just the federal state of cannabis, typically states don't allow crossover because alcohol is federally regulated. Cannabis is that gray area. So most places keep it separate.
Yeah. Okay. Great. Commissioner Dupree.
I loved what you said about the data to see if it was effective or not. And that also made me wonder if there's a time frame on this. Is there like an end date to the pilot, or are we just creating like an eternal pilot?
That's a great question. I am not sure.
I think that we should make that recommendation as well, that there's a time frame where we review the data.
Right. Yeah. Okay. I'll add that to my to-do list. Time frame for pilot. Yeah. Yeah. By definitions, pilots are time limited, right? So, all right. Anything else? I do want to leave time for public comment. Okay, so I think the plans for moving forward for our future meeting is for all of us to come with just our ideas written out, our concerns and our ideas for how to address those concerns. And we will review those and approve or not approve them or tweak them at our next meeting. So we'll work on getting another meeting on the books. It'll probably have to be a little bit of a longer meeting, maybe schedule it for 2 hours, and if we don't need it all, great. And then I think we will have knocked this out. So go team. Any final comments from the subcommittee? Good to go? Okay. All right, well then I'm going to move on to public comment. Are there any public, is there any public? I see a hand raised. Okay. Ms. Robinson, I'm going to allow you to talk. There you are. Go right ahead.
Hi, thank you. Good morning. My name is Karina Robinson, and I'm a training and compliance director for Taproot. I'd like to say hello to Ben and Jillian. It's been a while since I've been able to hear you guys or see any interaction with you guys. I've been following all of the committees out here, and I would just want to say that I appreciate the information that is being discussed in this committee today. One of the things that I do want to remind everybody is that we voted to regulate marijuana like alcohol in the state of Nevada. And the 18 and over, or anybody less than the age of 21, is very concerning for a lot of us here. We want to make sure that we are educated or that we're working with trained employees. And I can honestly say, working in the dispensaries and opening them and training staff for the last 8 years, that we all deal with poly-use customers and or patients or patrons that come into our buildings. So let's not exclude the training that we do have, please, when we are dealing with the dispensaries and the employees. I understand connecting this to a consumption lounge, but those employees are brand new in the system. And hopefully some of them will be coming over from the dispensaries to help. We just don't want to exclude current experience. The other thing that I definitely support is looking into our event coordinator or catering laws that are already available for large events. We already know that Burning Man is excluded from this for many reasons. We understand Life is Beautiful will be excluded because of the El Cortez. Reggae in the Desert is a perfect spot for something like this in that size. I also believe that the dispensaries and the owners of the dispensaries have paid enough into the system to be able to have events at any time, wherever they choose to. So there are laws that are not being addressed, such as public consumption laws and other areas that are causing concern with public health and safety. The one thing that I'd like to suggest, in just agreeing with everything that's going on here, is posting warning signs and making sure that there is a tent or a designated area for emergency services. For overconsumption, somebody could start to feel woozy and say, hey, I need to go sit down. I'd like to have a glass of water. Can we please make sure that these areas for people just to sit down? Well, I've seen that in the dispensaries. People just walk in to purchase products and they just want to sit down and have a cup of water once in a while. So I support having some area designated, please. And then also posting the warning signs so that everybody knows exactly where they need to go. Like when you walk into the event, oh, if I get sick, I need to go that way. We do know that the 18 and 20-year-olds are going to do their best to try to poly-use products. And that's why I support trying to remove that from this petition. I'm not trying to change their petition. We're just trying to make it make sense so that everybody can be included. And then also everybody gets to go home at the end of the night. As far as one more thing for Ben, Wi-Fi sales, we do have an option in the stores for anonymous sales. So if the Wi-Fi does go down, we are required to double check our identifications through the door. And then we have anonymous sales, and we also have paper sales transactions that we are still allowed to do under an audit. So at the end of the day, though, those must be entered into the system when the Wi-Fi is activated again. So those were my concerns, and I really appreciate being able to make a public comment today.
Thank you very much. Do we have any other attendees who'd like to make a public comment? You can go ahead and raise your hand. Okay, seeing none. Last call. Okay, seeing none, let's end this meeting 3 minutes early, shall we? Okay, thank you, everyone. We will be in touch to schedule another meeting, and I am going to call this meeting adjourned. Thanks very much.
Thank you.
Bye.